Here is a CT of the abdomen and pelvis that was performed in a patient who had had an oophorectomy for a right ovarian lesion, and they had incidentally noted a tubular dilated structure, and so they did a CT to further evaluate this. Now, if we look at the right colon here and we come down, we're going to see the ileocecal valve, and that's useful for being able to determine where the appendix is going to come off. And so here you can see the ileocecal valve right here. There's some fat that's coming around there, and then this is your terminal ileum. And when you come further down on the cecum, that's where you expect the appendix to come out, the same side as where the terminal ileum comes in. And we can see that there's a really thickened appearing appendix that's emanating off of the cecum. The appendix itself is here measuring around, let's put calipers on, about 25 millimeters in diameter. And there's some areas of calcification along the edge of it. The other thing to note as well is that the wall of the appendix is not particularly thickened. This seems to be material inside the appendix that's dilating it up. Now, things that we think about when we think about a distended appendix is we think about appendicitis. Appendicitis is not really supported in this particular case. One, because that's not what the clinical setting was. This patient didn't have right lower quadrant pain and fever. This patient incidentally had a note of some tubular structure that they wanted further evaluated. And there's also no periappendiceal stranding that we see on the CT scan. It's pretty clean, the periappendiceal fat. The other thing to note as well is that there's some peripheral calcifications involving this fluid collection within the appendix. And so this is actually very classic for an appendiceal mucinous neoplasm. These patients are important to pick up on because as the appendix becomes more and more distended with mucinous tumor, these things can actually rupture. And if they rupture, now you have mucinous neoplasm deposits within the peritoneum that can eventually cause peritoneal accumulation of mucin, which is referred to as pseudomyxoma peritonei. So it's important to note these things. And if you see a dilated appendix with or without calcifications, then we really have to raise that question of whether this could be a mucinous neoplasm of the appendix. The calcifications help support that. Mucinous tumors typically have a calcification associated with them, but you can also see calcifications with an appendicolith. So it's important to make sure that these calcifications are sure enough along the edge of the appendix rather than representing an appendicolith.